Okay. All right, we might get started. Thanks for joining us this evening. We've got a very informative session for you this evening, and the panellists and I were discussing as we were setting up how quickly information changes in this space. We feel like we should have put a little disclaimer in there that watch this space, it might all change sometime soon. Anyway, it'll be informative, and I hope you get a lot out of tonight's session. I'd like to start by acknowledging the traditional owners of this land where we're meeting today. I'm on Kaurna country. I live and work on Kaurna country. But PSA does recognise Aboriginal and Torres Strait Islander peoples right across this country as first people of this nation. We recognise Aboriginal and Torres Strait Islander history and culture, and it's inseparable from the collective history and culture. And it's something that we should all be proud of and we should all celebrate. So I pay my respects to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I'd also like to thank the Adelaide Primary Health Network, who've provided the funding for tonight's webinar. And we have a couple of guests who'll be adding to our discussions today from the Adelaide PHN. So a little bit of Q&A. You've probably all joined a Zoom session by now, but just as a reminder, if you could use the Q&A function, to send in questions to the speaker, or if you need to contact us with any of the problems. We've got Quinn from the PSA office here in Adelaide, and she and I will be curating your questions and fielding those through to the panellists as we go through this evening. We are going to have some polls this evening as well, so we'd encourage you all to respond to those polls. I'm going to introduce all of our speakers, and we do have a few, so bear with me. I'm going to try and quickly read through some bios and introduce all 5 of them to you before we get started. So first up, Naomi Burgess. She's the South Australian Chief Pharmacist, and she has over 30 years experience in a wide range of pharmacy settings, including executive, senior management, research and teaching roles within hospital, state government and university, and as a consultant in the private sector. She enjoys ongoing contributions at state and national levels in leading strategy development and ensuring outcomes in key areas of healthcare. So she has been really immersed in the rollout of COVID vaccines, but also the COVID-19 pandemic response in South Australia. So we're delighted that she can join us this evening. Robin Johns is the SANT branch president. She's the Senior Manager for Professional Services and the Chief Pharmacist for National Pharmacies. Robin also has been very hands-on with the rollout of the COVID-19 vaccination services for national pharmacies in 24 of their pharmacies. She is a pharmacist vaccinator, and she has been administering the Astrazeneca vaccine. And she also does the flu vaccine, I know, because she put it in my arm earlier this year. She was very gentle. Bastian Cremeri is with the Adelaide Primary Health Network, and he has a role in the My Health Record Officer. So he started in 2018, been really immersed in assisting pharmacies to register for My Health Record and training pharmacists in using the system. And then he's transitioned into the role of practice facilitator, and he's supporting primary health care providers in a variety of ways, such as the implementation of new digital health initiatives and the COVID-19 vaccine rollout. We also are joined by David Earle from the Adelaide Primary Health Network, He's worked with general practice pharmacists and specialists in a variety of digital health projects, including My Health Record, accessing the Australian Immunisation Register, and the associated work that's required around the PRODA system, the Provider Digital Access. And also Amanda Fair-Jones, she's PSA's Professional Support Advisor. So she's been at the front line of all of those phone calls from pharmacist members around advice, questions in relating to pharmacy practice, ethical and regulatory queries. She has spent most of her career working in large private hospitals. She's had experience as a pharmacy owner, community pharmacist, and working in mental health care. And she's doing an amazing job working with the PSA as our professional support officer, and we're really, really lucky to have her. Oh, we had pictures. There's pictures. You'll see them all come up. And we do have learning objectives. I won't read those through, but they're there for your records. I hope you have all discovered the PSA microsite by now. The microsite is a really comprehensive place to find up-to-date information, and particularly for information that is across the country. It's updated regularly. What happens across all of the state offices is when, as information comes to us, we're sending it through to the PSA support team, who are updating the microsite pretty much on a daily basis. So if you're looking for information, please have a look at the microsite. It's an amazing resource. Okay. This is how to get to Amanda, the pharmacist to pharmacist advice line. The phone number is down the bottom there, the 1300 369 772. And if Amanda can't answer your questions, then she has the whole resources of all of PSA to call on, and she will triage your question. It's generally 8:30 to 5 p.m. Eastern Standard Time on weekdays. All right, Quinn. Quinn is going to give us a live poll. Way you go, Quinn. I'd encourage you all to answer that poll. The question is, how many of you have commenced implementation of a COVID-19 vaccination service in your community pharmacy? So basically we're looking for a yes, no answer, just trying to get an idea of what's happening out there and who our target audience are. I'll just give you a moment longer to answer that. Naomi, if you'd like to share your screen. And Quinn, have we got a consensus on the answers?
We've got about 10 more people to respond, but mostly towards yes.
Mostly yeses. Excellent.
Can I just check with you if you can see my screen properly?
Can you just click the display settings and switch?
Switch.
Up the top. Yep, switch that one over.
Good.
Now you have to get the drop down. Click it again, you'll get a little drop down.
Is that okay now?
No, you're still on the presenter view. So up on the display setting.
No, I have, yeah, I've clicked it and it's changed twice now. So is that better?
No.
All right, let me try again.
Okay.
Let me get out of there.
Quinn, can we have some answers to the poll? Okay, we've got 75% of people attending who have commenced a COVID-19 vaccination service, and 25% have not. Okay. Perfect. Okay. Yes, lovely. I'll hand you over to Naomi. Thank you.
Okay, thanks Helen and to the PSA for inviting me to come along and speak tonight. I'm just going to give a really brief, I guess, overview and update of the South Australian COVID vaccine rollout. And just, I just wanted to preface my presentation by saying it's really been an unprecedented time for us, obviously, with this huge logistic and public health exercise that we've been involved with. And as it's been very challenging, and I'm sure it has been for you as well, it's also been a very rewarding time. So it's good to have the opportunity to speak to you tonight. If I can just figure out how to change my slides. Yes. So obviously this is really a national collaboration between governments, care providers, and of course our consumers, with the Commonwealth overseeing the program, so which vaccines are available in Australia, transporting them and distributing them around the country, and also running those expressions of interest that I'm sure many of you have participated in. So clearly it's been a stage rollout, and they've decided those stages. So when those vaccines were made available, what priority groups came first, what ages, and which providers were involved. So clearly pharmacies and GPs, and also aged care and Aboriginal health practitioner groups as well. So SA Health, or the state and territories' role in that, has been to work with the Commonwealth, particularly around workforce, so using our hospitals, our mass vaccination clinics, and we're getting into more outreach models as well now to try and reach some of those more difficult to reach consumers. But also we hold the state legislation, and I'll talk about the vaccine code, which highlights who can be vaccinated by who and where and when. Also, we've at a state level had that role of deciding which age groups we might want to prioritise, and at the moment we've got, for example, the Year 11 and Year 12 students being able to walk straight into one of our clinics without a booking. So it's been pretty flexible and dynamic, and as Helen said, things keep changing in that space. So just to give you an update where we're up to, so community pharmacies are obviously a very key partner in the South Australian rollout. Initially, we had 304 pharmacies approved by the Commonwealth EOI, with about 205 of those metro and almost 100 in our rural, regional and remote areas. So that was representing of about 50% of the total pharmacies in South Australia. So a reasonably good uptake. And as we know, that EOI has continued to be open, and more people are signing up at the moment. So in June, we were the first state, actually. Our minister was very keen to get pharmacies involved. And so we requested for access to the Astrazeneca vaccine for our rural, remote and regional pharmacies, and that rollout commenced in early July. To date, we know we've got 234 pharmacies actually vaccinating, and you can see the numbers there of 163 in metro and 71 in the rural and regional and remote areas. So a fairly good uptake. That's 77% of those approved under the original EOI. And the graphs you can see, or the maps, there are some work we're doing to try and map where those pharmacies are, and then to enable us to target more pharmacies potentially in areas where we know there's more need for vaccine access. So this graph on top shows a fairly rapid uptake from that date, probably around the middle of July, when pharmacies were able to join in, up to now approximately 17,000 doses have been given in South Australian community pharmacies. Again, that's the Astrazeneca vaccine, and really pleasing to see that really great uptake across that setting, where many people are obviously building this into their usual workflow to support the public health initiative. I've just included the state doses administered here. We did reach a milestone, it was late last week, of 1.5 million doses. That's 62.8% with at least one dose, and 44% now with 2 doses. So aiming to get to that about 80% at the minute. I have highlighted here as well the northern and western suburbs, Flinders, upper north, are areas where we know we've got some quite low uptake rates, and really trying to encourage pharmacies and GPs to perhaps get on board if they're in those areas. And also looking at our cold and vulnerable communities where we know we've got lower uptake as well. And so again, looking to every player in this game, I guess, to try and help us out to get to those people and get them vaccinated as well. I've just got the national figures there as well, and I'm pretty sure these will be out of date too by now, but around 24 million doses, of which over 500,000 have been given by community pharmacies. So a very key player, and I guess knowing that pharmacies can be accessed and are trusted by the community is one of those advantages that certainly we've noted and had feedback from our consumers. These two charts are basically showing the same information just at different time frames, only a week apart or so, but really just to show you the age spread of what we know has been delivered into community pharmacies as well. And you can see the main group is at 60 to 69 for Astrazeneca, but approximately 30% of those consumers are also less than 60 years old, so playing a really vital part in helping to get access, and obviously consumer choice and some consultation in that space to ensure that that's the appropriate vaccine choice for those consumers. If I move on now to the next slide, which is, I guess, fairly exciting for us, and starting this week is the Moderna rollout. So pharmacies are the first providers to provide this mRNA vaccine, so similar to Pfizer. We know we've got 11 million doses, with I think the first 1 million came into Australia on the weekend, and these doses will be administered over the next 3 or 4 months. With in 2 tranches, so it's an sped up rollout, if you like, which originally been in 3 tranches instead of 2, with 140 South Australian pharmacies should be receiving their supplies towards the end of this week, which we got in and ordered by I think it was the 4th of September, with another probably about 150, if not more, coming on board a couple of weeks later. So that's going to be available to initially 12 to 59-year-olds. And we were just talking earlier that I understand now the Commonwealth has also now communicated to GPs and to also pharmacies now that where a state policy is in place for a different age group, then the primary care and pharmacy can also pick up on that. And we're certainly moving forward at SA Health to enable the over 60s to also have the choice to receive the Moderna vaccine through community pharmacies. So watch this space for that one. Hopefully in the next 24 to 48 hours, we'll have that confirmation. And as I said, that's increasing consumer choice and access to those. We also know that boosters are being talked about at the moment, particularly Moderna may have a role in that. So pharmacies may also have a role in the booster rollout. Still a lot of discussion going on about how that would look at the minute, particularly looking at perhaps the more vulnerable groups and those at higher risk as the first priority to make sure we use the vaccine wisely across Australia and also internationally. So this slide is just to show a quick couple of differences between Astrazeneca and the Moderna. So both have 5 ml multi-dose vials, so both with 10 doses in. Some different storage requirements. So the mRNA vaccines, as we know, have a requirement for freezing, so -25, with a 2 to 8 degree storage for 30 days, which is what we'll be seeing in pharmacies. There's a little bit of controversy about the punctured vial information now. As I understand, this information I've got here is that at 2 to 8 degrees, it's stable for 19 hours and an expiry of 19 hours. But I understand that ATAGI may have introduced some new information of perhaps 6 hours recently. So we'll be looking at that as well to determine what the final recommendation is. Differences in the timing of them, so 28 days apart for the 2 doses of Moderna, as opposed to 4 to 12 weeks apart for Astrazeneca, and Moderna is really going to be, like Pfizer, much more preferred in the pregnancy group, with further information and safety information about pregnancy for the mRNA vaccines. I won't focus too much on this one, other than to say, obviously, if you're going to be now having multiple different vaccines in the pharmacy, then it's going to be really important that there's some risk assessment and risk mitigation strategies put in place to make sure that patients are getting the right brand, the right dosing interval. And some of the recommendations, and I think some of this is from PDL as well this week, is to make sure that you have different processes and perhaps consider different days and different storage, etc. And equally, the consent checklists, etc., will need to be reviewed and talked through with the consumers. As far as the local legislation goes, you'll be familiar with the Vaccine Administration Code, which provides authorisation for pharmacists to administer vaccines without a medical order. And all the conditions of the code need to be met to meet the EOI, but also meet the local legislative requirements, and I've listed them there. I did want to just highlight today that the approval has to be sought from SA Health, our Communicable Diseases Control branch, for each vaccine type that you might want to administer. So if you're already doing flu, you still need to reply to them for doing COVID. And equally, if you change your name, ahead too quickly, or even the name of your pharmacy or the owner changes, to just make sure that you re-register with them. They're currently asking everyone to be reapproved. They've slightly modified what's required, and they have given a provisional approval for those doing COVID until the 6th of January, but I really ask you to get in there and do get that sorted. I know there's quite a few still outstanding. Another topical issue at the minute is that outreach programs may now be looked at for pharmacies as well that can take those on. And just to clarify that our code does not specify that the vaccine must be administered in the pharmacy, so there's no legal barrier to that. A couple of other updates are that, of course, our COVID-19 vaccinations listed have no age or vaccine limits on them. It's a little bit different to some of the other states who been very specific about what they put in their legislation. Ours is quite general. And as well, now the intern pharmacists under direct supervision of an authorised and trained pharmacist can be available to support that workforce with the correct training. So I'll just finish off with a couple of quick slides. So we've continued to engage with the professional groups during the COVID pandemic and really appreciate that exchange of information and working together. We have sent out a survey just recently to try and better understand any barriers or support that might help more pharmacies to come on. We do have a really strong interest in supporting pharmacies to move forward. You may have also seen that we've set up an NIP advisory group now, and that will develop up some recommendations to the Minister to consider pharmacies for access to NIP in South Australia. A couple of other things, telehealth, electronic prescribing, and I'll whiz through because I think we're cutting short on time. Obviously, we have to enact legislation to support a number of the other Commonwealth strategies as well, such as the serious shortage notices, the limits on dispensing. And we've also introduced a support program for critical community pharmacy services. In the event that a pharmacy is shut down due to COVID and not able to reopen, there's an application process for that, which we can talk through in more detail. And just to finish off, I've just got some resources there available on the SA Health website for people to access, which are continually updated, which is important, noting that things do change quickly in this space. So thank you. I'll leave it there.
Thanks, Naomi. While Robin Johns prepares to share her slides and present, Quinn's going to share the second poll. And this question is $16 a vaccination sustainable remuneration for immunisation services in the community pharmacy? And you've got a choice of yes, no, or I don't know. A reminder that questions can go in the Q&A box, and we'll come to those after the presentations. I think our first presentation from Naomi gave us some really good insight in what SA Health is doing, but also some of that key information about where we need to focus our attention. So vulnerable communities, cold communities, northern suburbs of Adelaide, in trying to encourage people to get vaccinated. So Quinn, have we got a response to poll 2?
We do. I'll end it now and share the results.
Thank you. Right. Well, there's no real surprises there. That 57% of you said no, $16 per vaccination is sustainable, and a small number think that yes, it is, and we have some that don't know. Thank you for your response. We'll move on now to Robin Johns, who is ready to go. Thank you, Robin. Over to you.
Thanks, Helen. This is quite a big topic to do in 10 minutes, so we'll rush through and really just try to give you some tips of where to go and things that have worked and not worked for us, and things we need to really consider, particularly going forward, having another vaccine in our pharmacies. So where are we so far? So, of course, we can administer the Astrazeneca COVID-19 vaccine. We started doing it on the 19th of July when our regional remote pharmacies, thanks to SA Health, we had access to the AstraZeneca vaccine. It was great to see our pharmacies starting to really support. I think we really wanted to start in May when we originally promised, help our communities, where accessible health professionals. If you've got someone who's nervous about a vaccine, they come in, they talk to you, you can vaccinate them straight away. Familiar surroundings, we're trusted. And then, of course, on the 16th of August, we started as well. So there's me doing one of the first vaccinations on the 19th in our pharmacy in the Hills. So setting up the service, of course, the first thing you've got to do is respond to the pharmacy programs administrator. Anyone who's registered with the PPA was sent an email to register. You can still use that. All pharmacies were sent one prior to the expressions of interest finishing for the Moderna as well. So please get on board. If you haven't done it, you can still get involved. And we really need as many pharmacies involved as we can. We've got quite a lot of Moderna to administer, and we really want to get the 80% up in this state really, really quickly. You must, as Naomi said, update your vaccine service with SA Health. It's really important to do that. And that's happening pretty quickly. Within a couple of weeks, you can get that back. It's pretty easy and quick to do. So it's really important to do that. The next step, of course, is setting up a booking system. You can use your own booking system. The Health Direct, who's running the government eligibility checker, has also got a booking system that you can log into her help. So you can set up those, or you can use your MedAdvisor, GuildLink, or Health Engine booking system. Of course, the next step, a very important step, is order from the Cv Cpa Portal, which is the COVID-19 vaccination community pharmacy portal. So that's where you do all your ordering, your receiving of your medicines, your vaccine when you come in. And of course, link to the PPA for your payments, automatic payments. So it's important to get all your systems up and running. All of the organisations will help you, and they're really easy to link through. So the booking systems, of course, as I mentioned, you can use any of the booking systems that are there or your own. Great because they link to your recording system. They will send out the consent forms, the pre-screening questionnaires, and that will then populate through to your recording systems, whether it's MedAdvisor or GuildLink that you're using. And it really does help to manage those patients effectively. Of course, we've also got to do the dose preparation, which we will get to when we talk a bit more about the workflow. Dose preparation, as you're probably aware of, has to be done in somewhere separately from the pharmacy instead of in front of the patient or the same place you're vaccinating. We all have compounding areas in our pharmacy, so that's an ideal place. They're normally right next to the fridge, so excellent place to do your dose preparation. So preparing the vaccine is really important, and particularly we're going to have more than one, is check all the time. Check the expiry every time. Label every time. So you're only making up one vaccine, you've got one person coming in for Astrazeneca as their second dose. Okay, I'm not going to worry about labeling. It's really important. If something happens, you put that vaccine down, you've actually got the label and the time that you actually drew it up. So you know how long it's been at the fridge if something happens, an emergency happening. If in doubt, if you're not sure how long it's been out of the fridge, please throw it out every time. Really important to mark the vials of exactly when you've taken a vaccine out. Now with the Moderna vaccines, the drawing up needle will be the same as the administration needle. And I'm not sure, I assume a lot of you probably got your consumables in them at the moment. And notice the BD syringes are different to what we have used to with Astrazeneca. We've been trained to use one drawing up needle and then one administration needle. Very difficult when you've got the needle and the syringe attached together. So in all of the guidelines, it does say in a pandemic, you can use the drawing up needle and the administration needle can be the same needle. And that's what we're going to have to do with the Moderna vaccine. So be aware that, make sure that you do not puncture the bung at the same spot. You must rotate it around because you may core the vaccine. If you do core the vaccine, you get particles. Again, if in doubt, throw it out is what we need to always remember. So we always must mark the vials, check the dose and the volume every time before you vaccinate, after, when you put the label on, all the time, to make sure you are getting the correct dose. Making sure that you haven't got big bubbles in there. It's not the bubbles that probably cause any problem to the muscle. It's a 0.5 dose. So we've got to make sure we get the right dose to the patient. Store the vaccines in separate containers. So as Naomi was saying, you need a process to make sure that you are keeping those vaccines separate. So if you've got a morning or an afternoon clinic and you want to do them at the same time or an hour between them, that is fine, but separate containers in your fridges, separate colour containers, so that you can easily identify which one you're getting out of the fridge. Of course, as Naomi in her slide said, the Astrazeneca vaccine must be protected from light. So it always goes back into the box as shown on the slide to protect it from light when it's back in the fridge. And the boxes that we store the prepared syringes in, which go back into the fridge, really need to be opaque as well. Not that easy to find, but IKEA do have some, so that's a tip for you. They're the cheapest ones I've seen around, and nice flat ones to be able to store in. Now, the other interesting thing that we have seen, if you've gone through the rollout documents, it talks about destroying the boxes and also how you get rid of the vials and wastage. So what we do with the boxes is you need to actually make sure that you either cross through them. I recommend put them through a shredder. And the vials need to be disposed of so no one else can get hold of them. I didn't really appreciate this until dealing with this. There actually is a black market value for the COVID vaccines. So we would hate for someone to get hold of a vial and fill it full of saline and then sell it on to somebody else. So really important that you destroy them properly. Our rum bins, of course, can take those, and of course they will get incinerated and you can't get the item out of them, and shred the boxes as well. If there is any wastage, make sure that you do, I guess, put the wasted vaccine into the rum bin as well. That's fine to destroy it that way. And I'm not sure if everyone's aware that even when you're cleaning up between the two vaccines, if there's a spillage, there are two different chemicals that you should be using to clean up. The suggestion is ethanol, which we will have in our dispensaries, in our compounding areas, to clean up the Moderna vaccine, but you need something that will kill a virus, so viricide disinfectant, to which we all probably have been cleaning down our benches with anyway in our pharmacies, and that's what we clean up the Astrazeneca vaccine with, if there's a little leakage out the vial. And we may get that a little bit more with the Moderna vaccine, because we're going to have to enter that bung so many more times with the consumables that we're given. So patient education, of course, is really going to be important. So, and that keeps changing. So I hope everybody is going back into the modules and checking for those updates. It's really important that we do really keep up to date and review those modules. Print the patient information and have that ready to go. We don't want anybody to leave our pharmacies without information that they can read. And if possible, if you're in an area of people with different languages, find out which would be appropriate for them to print out for them. On the rollout documents that we received, there is a whole lot of resources in document 3, and has all different patient documents and links for different languages as well. But be confident, and we know that our patients are coming to us because they trust us that we'll give them the correct information, look after this. And I've had lots of feedback, I'm sure you have as well, of people who wouldn't have been vaccinated against COVID-19 if it wasn't that we were giving the vaccine. So pre-check, everything is check, and I'm sure you have a process in your mind, and there are some checklists that you can print off. And new pharmacists to the vaccinating with the COVID vaccines, I suggest that they print off those checklists that come out the rolling out documents. You probably only need it for 1 or 2, but after the first day, you'll have those in the, like we do with influenza vaccines, you'll have all that checklist in our brains, and we'll know exactly what to say. So the first important thing, of course, is check the patient age. Particularly not so if with the age is changing, but make sure that you're giving the appropriate vaccine when you assess them. So you need to have the patient's age, or make sure you're checking that immunisation record beforehand. You need to know which vaccine they've had beforehand. Have they had another vaccine close to that vaccine? We have to give the 7 days gap, but it's more that we are giving the right vaccine for that right patient. So check beforehand. If you're using one of the platforms that automatically, MedAdvisor, Guild link, that will automatically bring up AIR, which is great if you link it up with AIR. Makes it so much easier. Automatically you see the history from that patient. Always asking the patient which vaccine. Now, which vaccine have you booked in for? You are expecting the Astrazeneca vaccine or the Moderna vaccine. Always double checking with the patient what they're expecting. Get all the patient details and history, check their pre-checklist and go through all that with them, and assess them for that vaccination. And of course, the last one, always check the vaccine. Always make sure that the dose is correct. You may not have made up that dose. So check the vaccine, check that it's labelled, check that you're giving the vaccine that you think you're going to give to that patient. So always check and make sure that there's nothing, no particular matter in, that it looks okay. If it doesn't look okay, get another vaccine straight away. And of course, after, the most important thing is that we've got 24 hours to upload to the Australian Immunisation Register. And again, if you are linked with those booking platforms and got it set up correctly, and with all the details correct in it, and the help desk from MedAdvisor, Guild Link, will help you with linking to AIR. It will just upload it. As soon as you click complete, remember to click complete, it will upload to AIR, which just has, that workflow has really saved the time for us doing this vaccine. Make sure the patient hasn't got any questions to ask, that you've given all the information that is required. Make sure that they stay in the pharmacy for 15 minutes. As I say, we can't tie them to the chair, but I think we had the discussion with them to say, this is a new vaccine. If you're shopping at Coles next door, I can't help you if you have a reaction to it. Please stay in the pharmacy. And we've taken the tip that some of our pharmacists have brought back from the clinics like at Wavell, and we actually have got stickers that we put on people with a time that they can leave our pharmacy. That seems to work really well, and no one seems to mind, and everybody has been compliant with staying for the 15 minutes without any issue at all. Of course, while they're waiting, please get them to book their second dose. It's really important that we do get them back for that second dose, because that is going to help protect them and the community so much better. The other really important thing to do, we get a lot of questions, is where can they view their vaccination details? Yes, we can print out the details for them, but electronic versions of them do exist, and it's great to have a discussion with them and maybe train your pharmacy assistants to have that conversation with them as they're waiting, and maybe even if you've got elderly patients, they could help with explaining how to set them up. So really the four main places where they can get it from, is their Medicare online account, MyGov, that's it. The Express Plus Medicare app. I don't know if many of you have, I have definitely got mine on downloaded on that. It actually has your Medicare card on it, but actually has a certificate to say I've had both my vaccines. Of course, they can also get it through Australian Immunisation Record, and it's on My Health Record as well. But it's really good to get them used to using them. So many of our customers are so used to apps now, having to scan in, that most of them have been appreciative that you've actually showed them about the Express Plus Medicare app. It's pretty easy to use if they've already got a MyGov account and got Medicare attached to that. One of the last things I want to talk to you about is hand hygiene. We have had a few complaints about pharmacists not doing hand hygiene quite so well. And it's not that we are probably not doing it, it's that if you're like me, you don't like wearing gloves, you don't get that good enough feel for injecting with it, and it slips around, is that they don't see you doing it. So this is just a little diagram of every time you need to do hand hygiene, every time before you actually prepare the vaccine. Remember, it's really important to clean the area down, and also then clean your hands thoroughly, wash them, or use the hand gels in between time. But have your hand sanitizer there, pump it, show them in front of them before you inject that you are doing the hand hygiene before. If you're like me and also always brushing your hair out there, remember, do hand hygiene, or if you actually pick up a pen. So making sure that every time before you touch the vaccine to vaccinate or touch the patient, that they actually see you do your hand hygiene, and then we won't have any issues and any couple of complaints that we have had before. And of course, we've talked about the Moderna as well. We'll have the first lot coming out at the end of this week, and some of us have already got it, which is wonderful. And then the second lot coming through. Just remember, order, and when you receipt it in, order again, because it takes 2 weeks for you to get the next lot in, and we know we're going to be run off our feet giving Moderna. Thank you, Helen.
Thanks, Robin. So I think there's a very comprehensive walk through in a few minutes of what you need to do. But thank you very much, Robin. Very comprehensive summary there. While Bastian and David are prepared to share their slides, Quinn's going to run another poll. So we'd just kind of like to get some feedback for the Adelaide Primary Health Network about how many of you are really confident that you are connected to product and connected appropriately. This is really important because this is how PBS payments are going to be processed from early next year. Quinn, have we got the answer to the poll?
Half have responded. I can share the results now.
Thank you. Excellent. 73% say yes. Fantastic. Good job. And we have 27% that either say no or don't know. Thanks for responding. And over to you, David.
Thank you very much. And yeah, that's a great amount that are all ready to go. Some of what we talk about, you will hopefully recognise and understand, and for the others, yeah, it should be a good learning experience. It's also worth noting that it's just a quick run through here. You might not get a full appreciation of what needs to be done prior, but yeah, both myself and Bastian at the Adelaide PHN, yeah, we're certainly happy to help you out, and we'll provide some contact details there. So how to check if you're ready. So this refers to your ability to access the Australian Immunisation Register. There's a few things that need to be done prior. As I said, you may have already done these steps, especially if you're already accessing and submitting AIR information. For those that haven't, or maybe partially gone through these steps, we'll go through the process. So first of all, you will need to ensure that you have both an individual and an organisation Proda account. If you're not sure if these steps are complete, you can log in to your individual Proda account. On the top right, you can select organisations, view the organisations that you have joined, and should also be able to see the organisations that you need to access the AIR on behalf of. So if you've been delegated access, that's the same spot that you should see that. You should then be able to access the Health Professional Online Services tile, or HPOS tile, and from there, the AIR, or the Australian Immunisation Register. We will touch on how staff will be delegated in a bit. So Robin mentioned that your software provider may be able to access AIR on your organisation's behalf. So this means that the submissions, but also the AIR history, can be viewed from within the software without having to log into Proda. So yeah, definitely check with your software vendor if this is an option, and they can provide further details on what needs to be done to configure that functionality. There's some Services Australia's forms that need to be completed for that as well. So we'll go through a few tips on registering and delegating access to staff members. So this information would be useful for a director or someone that will be in control of the organisation's Proda account. If you're not sure where to register for your individual Proda account, Google Proda, it should be the top link, select register now. And if you're unable to provide the required identity documents, contact the Proda support line, and they will support you through that bit, including providing any forms that might be needed to fast track that verification. If you already have a Proda account, you will need to ensure that your name on your identity documents matches letter for letter to the name that's recorded against the Australian Business Register. So this is for those that are creating that organisation Proda account. As long as you're listed as an associate or authorised contact against the ABR, then you can create the organisation Proda account and join as a director, which gives you full access to that organisation Proda account. The organisation Proda account will then need to be linked through to AIR, and this is done by adding HPOS as a service provider to the organisation. You will then verify your business with either the AIR authentication name, file name, or the AIR linking code, whichever one you have received when you first signed up. So in particular, this step, sometimes it can be a bit tricky to fill in all the required information that Proda needs. And as I said, yeah, we'll let you know how to get into contact with us if you do get stuck in any of these parts. All right, so to add members, add staff members to view AR on behalf of the pharmacy, you will need their surname and their Proda registration authority number, or their RA number. So staff can find their RA number. They just log into Proda, select profile on the top right, view my details, and then their RA number will be listed there. So people that can add a staff member to the organisation will be a director or a member that has been delegated access with the employee management attribute. So they're the ones that can select the add member as shown in the image down the bottom. To delegate access to those staff members that you have added, you just need to select their names, select delegate to this member, and they need to have the HPOS access attribute, which means that they will then be able to access the AAR through their own Proda account, and that will be through the individual proprietor account there. So in an ideal world, going through your software is going to be the best. So I know Guildcare, MedAdvisor, these are platforms that are AIR integrated software. Otherwise, through PRODA, HPOS, you can then access the AIR. Otherwise, there is the Clinician Vaccine Integrator Platform, otherwise known as CVIP. This is a platform that provides a workflow solution to providing the vaccine to the patients, allowing you to view and submit data from the AIR on a web-based platform. So this is an interim solution for sites that do not have the AIR integrated software, and it's provided by the Australian Digital Health Agency. So down the bottom, you can see our email address there, so digitalhealth@adelaidephn.com.au, or we have our main line there, and feel free to call through to that and ask for the digital health team. So a lot of the work we've been doing with pharmacy has been the NASH certificate support, and certainly any questions around digital health in general, feel free to share that through. All right, I'll now hand over to my colleague, Bastian.
Thank you, David, and hello, everyone. In the next couple of minutes, I will explain how and when you can get access to surgical masks through the Adelaide PHN. At the moment, COVID is under control in South Australia. Everybody seems to be used to mask wearing, and there's plenty of commercial supply available. But I think if there's anything that we've learned in the last 18 months, it is that things can change very quickly. In saying that, please make sure that you stay up to date with the directions from SA Health, because it's very much a changing environment that we're in. Those changes in public health directions and/or a possible outbreak of COVID may impact the supply and demand of PPE very suddenly. This can make it very challenging for you to get your hands on surgical masks through your usual suppliers. And this is basically where the PHN can come to rescue. So the Adelaide PHN has access to the National Medical Stockpile in times of need, and this is under the directions of the Commonwealth. Next slide, please, David. So those directions are basically that you can request one box of 50 masks at a time from us in case you are experiencing difficulties sourcing surgical masks from local commercial suppliers, and when you are likely to get in touch with people that are having fever or respiratory symptoms. It's needless to say that any PPE that we provide cannot be sold to the public. They're really just for the use of the staff in the pharmacy to protect themselves. Next slide, please, David. So for you to actually request those masks, you will need to submit an expression of interest form to us. You can find that expression of interest form on our website, adelaidphn.com.au. When you get onto our landing page, at the top of the screen, there will be a link to our COVID-19 section. Once you've clicked on there, you will get to our COVID-19 page. And then you have to go to the COVID-19 quick links and information, where you will see masks and PPE distribution. Once you clicked on there, you will then be presented with a link to the expression of interest form for community pharmacies at the second bullet point. This is where you can download the form. After completing it, you can send it to covid19@adelaidphn.com.au, and our team will then process your request and send you the masks if you are eligible. And of course, this is free of any charge. And I guess that's basically it from us. We're happy to take any questions that you have. Please put them in the Q&A if you have any. And otherwise, back to you, Helen.
Thank you so much. I would encourage anyone who's got any problems accessing PROTA or any just sort of general digital health questions around the changes that are taking place to reach out to the PHN. They've been very, very supportive of pharmacy. We do have another poll for you as we prepare to hear from Amanda. So can a pharmacist provide Moderna Spikevax, I quite like that name, Spike, to a 63-year-old patient in the community pharmacy? You've got a yes, no, I don't know response. Have we got responses there, Quinn?
We do.
Excellent.
I'll share the results now.
Thank you. So 44 said yes, 32% said no, and 24% said I don't know. Safe to say we will have that question answered for you before the end of tonight. Over to you, Amanda.
Thanks, Helen. So as Helen introduced me, my name's Amanda and I work at the PSA as a professional support advisor. And today I will be discussing the top 5 COVID-19 vaccination related questions. So in my role as a professional support advisor, I provide advice to pharmacists in what we at the PSA refer to as the pharmacist-to-pharmacist advice line. So this is a member benefit exclusive to PSA members, where professional advice and support is offered on a range of topics that includes, but is not limited to, practice-related queries, including professional practice standards and guidelines, ethics-related queries, technical queries about medicines, compounding, and medicine availability, and even medicine information, regulatory queries, and also registration queries, including CPD requirements and APRA requirements. So it probably comes as no surprise that a large number of questions I've been asked over the past 18 months have been in relation to COVID-19 and the vaccination rollout. And that's what I'll be talking to you about tonight. So over the last couple of weeks, probably the most common question I have been asked, which has already been discussed tonight, is what are the COVID-19 vaccine age restrictions? I thought I'd discuss it in relation to both vaccines because there has been errors with the Astrazeneca vaccine. So firstly, the most important thing to understand is that you follow your state-based legislation. So your legislation provides guidance around age restrictions. So in South Australia, the legislation is in line with the TGA approval for the vaccines. So for Astrazeneca, the TGA has approved the vaccine for individuals 18 years and older. In accordance to the ATAGI guidelines, the benefits of the Astrazeneca vaccine outweigh the risk of adverse effects for those 60 years and older. So the Moderna vaccine is TGA approved for individuals 12 years and older. The Commonwealth has eligibility criteria for this vaccine, and that's for individuals 12 to 59 years. However, as recently as last night, the PPA, the Pharmacy Programs Administrator, has released advice to pharmacists, essentially saying that the Commonwealth are aware that some state and territories have expanded their eligibility criteria further than this Commonwealth eligibility. And what they have said is that provided there is plenty of supply of the COVID vaccines for priority populations, that states and territories can look at providing the Moderna vaccine to their expanded criteria. So I guess essentially in South Australia, legally, individuals over 60 years old can be vaccinated with Moderna. However, this has to be in accordance with South Australian eligibility criteria. And as Naomi said, this information might come through within the next 24 to 48 hours, but it's a watch this space. And that's on the proviso that the provided vaccines are still prioritised for the priority populations. Now, just for your information, the priority populations are those that were prioritised in the national government rollout in phase 1. So they are the aged care and disability workers and residents, Aboriginal and Torres Strait Islanders, 12 years of age and older, healthcare workers and individuals with underlying health conditions. So another question I've been commonly asked, this is in relation to the Astrazeneca vaccine, is what happens if the second dose of the Astrazeneca vaccine is missed or given late? So the Astrazeneca vaccine has an interval of 4 to 12 weeks. I think when answering this question, it is important to look at the recommended dosage intervals of the vaccines. So even though the recommended interval for AstraZeneca is 4 to 12 weeks, the actual preferred interval would be 12 weeks. And this is because at this interval, it's been shown to have greater efficacy. An interval of 4 to 8 weeks is preferred in an outbreak situation. And this is because of the benefits of having 2 doses in protection against severe COVID. So for the Moderna vaccine, the recommended interval is 4 to 6 weeks. The preferred interval for Moderna is 28 days. And in accordance with ATAGI advice, the absolute minimum interval for Moderna is 14 days, and there's no maximum interval between doses. So in answering the question, what happens if the second dose of AstraZeneca is missed or given late? The advice is that the second dose should be given as soon as possible, and at this stage, no further doses are required. The second dose will still be effective, regardless of how late it's given. Another question I have been regularly asked is, what is the advice for pregnant women and COVID vaccination? So pregnant women should be prioritised for COVID-19 vaccination, and they should be routinely offered either the Pfizer or the Moderna vaccine at any stage of their pregnancy. The real-world evidence has shown that both the Pfizer and the Moderna vaccine are safe for both women who are pregnant and breastfeeding. So the reason the COVID vaccine is prioritised for pregnant women is they have a much higher risk of severe illness from COVID, including around a 5 times increased risk of needing admission to hospital, an increased risk of needing admission to ICU, an increased risk of needing ventilation, and there's also a slightly increased risk of their newborn being born prematurely. So there's a document titled the COVID-19 Vaccination Shared Decision-Making Guide, and it's available for women who are pregnant, breastfeeding, or planning pregnancy to provide them information to help them make an informed choice around COVID vaccination. Just as a side, for breastfeeding women, Pfizer and Moderna are also the preferred vaccines, and women do not need to stop breastfeeding either before or after COVID vaccination. So the information on this slide has been previously discussed as well, but with Moderna starting to roll out to community pharmacies, I have been asked about the storage requirements for the Moderna vaccine. So for the Moderna vaccine, it comes as a multi-dose vial and it's drawn up similarly to the AstraZeneca vaccine. However, storage is slightly more complex when you compare it to AstraZeneca. So the Moderna vials are stored frozen at -25 to -15 degrees Celsius. However, Moderna will be delivered thawed to pharmacies, and the thawed date will be visible on the insert containing the vaccine. This is important because the unopened thawed vials can be stored at 2 to 8 degrees for a maximum of 30 days. But that 30 days will be the date that the vaccine was removed from stored frozen storage and thawed. So there is a potential that Moderna vials will arrive in your pharmacy with less than 30 days expiry. So once thawed, the vials can be stored unopened at room temperature between 8 to 25 degrees Celsius for up to 24 hours. And then the last point here that has been discussed, there's varying information available, and that is around the stability of open vials. So there's data supporting the stability of open vials stored between 2 and 25 degrees for a maximum of 19 hours. And that's the information in the Moderna Spikevax product information. However, ATAGI recommends that the cumulative storage of open vials should not exceed 6 hours. And the reasoning behind this is there's not any antimicrobial preservatives in the vaccine. At this stage, the advice is to follow the ATAGI guidelines and only keep the open vials for 6 hours from the point of opening. But as it's been previously discussed, this is a watch this space, but for the moment, it's the ATAGI information that we're recommending pharmacists follow. And probably the most common question I have been asked throughout the COVID vaccination rollout is, how do I self-record and can I count my COVID vaccination training towards my annual CPD? So all pharmacists administering COVID vaccines have to complete the Commonwealth vaccination training for COVID vaccines. It can be counted as CPD in accordance to the Pharmacy Board standards. Activities that address your professional development needs, are relevant to your scope of practice, and are conducted by qualified persons can be counted as CPD. The number of CPD that you can record is determined by the time it takes you to complete the activity and which modules in the training you completed. If you're administering vaccines, it should be all the modules, I guess with the exception of Pfizer, if you're not administering the Pfizer module. It's also important to note that you can count CPD for the time it takes you to go back and read the updates as you're legally required to do. So once the modules have been successfully completed, they can be recorded as Group 2 CPD, and there's 2 points per hour of activity that can be counted. So the slide here just has an estimate of the duration it might take to complete those modules. And finally, I just thought I'd put up a slide with information about pharmacist support services. So the vaccine rollout can be very stressful, and it can become additionally stressful if there's COVID being transmitted in the community. So pharmacy support services provides a great service with a team of volunteers trained in peer support and telephone counselling. And I just think it's really important for pharmacists also to take care of their health and wellbeing and know where they can go for support if it's required. So thank you, Helen. That's it for me.
Thank you, Amanda. If I could invite all the panellists to reveal themselves again. We do have some questions, and reminding people to put any questions that they've got in the Q&A section, please. So I'll start with some of the questions that either have come in the Q&A or that we've got online or prior to this session. So the first question, and maybe either Naomi or Robin can answer this question, is how does a pharmacist report COVID-19 vaccination to the AIR when they don't have a Medicare card?
So there is, I can answer that, there is a special Medicare number that you can use, and that can be used, and that gets uploaded to AIR. That I'm trying to think where that is now. I think the Pharmacy Programs Administration has that as well on their website, but we can source that information where it is. I'm trying to think. Naomi, do you remember where?
It's in the guidance package on voting pack number 1, and I'm just flipping through to see which page it's on. It is in here, and you can ring the emergency number. That's basically the answer.
Thank you. Robin, while you're there, we've got some questions around needles and syringes. So can people use their own rather than the Moderna ones that come with it? They don't like using the needles that are attached. They want a separate drawing up needle. What's your response to that?
One of the things that it does look very different from the other needles that we are sent with the Astrazeneca, and I guess that is very helpful to not mix up the vaccines. So I can give it a 1+, but I get where that's coming from, having to pierce the bung a number of times instead of just using one drawing up needle if you need to draw 10 doses at once. And if you do have consumables that you may have left over from the Astrazeneca, there's no problems using that. It's still the intramuscular injection, the same dose, so the same syringes and the same needles that have been supplied. If you've got them left over because you've had wastage from Astrazeneca, that's fine. Or if you have them already in your pharmacy from other vaccinations, intramuscular vaccinations, we know we have lots of needles. We need to put them on a Boostrix, we need to put a needle on. That is fine for you to do. You don't have to use the government consumables.
Thanks, Robin. A question for Amanda. Someone's encountered a patient who didn't have a COVID injection, but it's appeared on her AIR statement that she has. The pharmacist has tried to ring the AIR but can't get through. What would you recommend that they would do in that case, please, Amanda?
Yes, so this query has come up on the advice line previously. The patient was actually in New South Wales for this in this instant. The advice at the time was it comes down to the pharmacist's clinical judgment. So if they are sure that it's a reliable patient and they're sure the patient is telling the truth about not receiving a vaccine, then using their clinical judgment, they are able to administer the vaccine. And then the pharmacist or the patient will have to contact AIR and sort out their record. Essentially, there has been mistakes made on AIR. It is such a big vaccine rollout that there is reason to believe there has been issues and people make mistakes in entering data into AIR. I guess on the flip side, if the pharmacist wasn't confident that the patient was reliable and they had any doubts, they could recommend then that the patient goes back to AIR and has the information sorted so it's all correct on AIR prior to administering the dose.
Thank you. There's another question here. So Amanda, would you just stop your screen share too, please? A question here, do we need to have the working with children check to be able to administer the Moderna vaccine to a 12-year-old? Robin's nodding. I'm very definitely nodding. We've been trying to get this information out to pharmacists. You are required to have a working with children check if you are working with anyone between the age of 12 and 16. That's the age that legislation kicks in South Australia. And not only that, if you are an employer of someone who is working with children, you are also required to have a working with children check. So if you don't have a working with children check and you are going to be offering vaccination services to children between the age of 12 and 16, or if you are providing counselling services to children in your pharmacy, sorry, I'm wrong there, it's anyone under 18 for this legislation. So anyone under 18, and you will often see young people in your pharmacy, you must have that working with children check. It's quite a significant fine if you don't. It's something like $5,000 or something if you haven't had one in the last 5 years. So I suggest you get onto that. There's another question here about the provisional approval letter. Naomi, do you want to take that question?
Yeah, so the provisional approval was given to all the pharmacies that we knew were approved under the EOI in a recognition that there was going to be a lot of approvals needed in a short space of time. So it's only valid until the 6th of January. And before that, you do need to apply and have full approval from CDCB to continue doing any vaccinations, including COVID vaccination. So as I said, I know there's quite a few that are outstanding at the moment. It is a bit confusing. The CDCB have changed their requirements, and so they're seeking everyone to be reapproved for whatever programs that they are wanting to deliver. I don't think they give you a separate number, but they do list which programs you're authorised to provide. Yeah.
So that provisional approval lasts till the 6th of January. So if you haven't got the details of where to apply for that, we'll put that in the follow-up email after this and show you where to get that information, get that provisional approval. Really interesting question here. We received our Moderna today and couldn't see any date of thawing. Can we clarify where this thaw date and time should be written? No.
This might be a newbie for us.
Yeah.
That might be the VOC.
I took, Helen, when I was doing my presentation, I took the information directly from the COVID vaccine training module, and it said it would be visible on the insert containing the vaccine. I don't know if that helps at all. I haven't physically seen it myself.
No, I haven't seen any either.
We did have a pharmacist on before, but she's not with us now, who had, oh, there's Morag. Sticker was on the outside of the box. Morag has received her Moderna in her pharmacy, and they've got 50 people lined up, she says, on Sunday, which is a fantastic effort. So sticker on the outside of the box. Have a look there. We do have a little bit of time for more questions, so if people have got more questions, please. Okay, so yeah, I would strongly recommend, if you haven't seen a sticker, I would actually be looking for that on your delivery before you sign off on that. So you need to see those details. If it's fallen off in the truck, then you shouldn't be accepting the delivery. And the training module does have information on where you need to report that. So Morag says it wasn't on the actual product, it was on the outer carton. So I would be looking for that before you sign off and accept the delivery.
And the place to go, Helen, now, because it's been delivered, is it's called VOC, Vaccine Operations, I can't remember what the C stands for. There's a number in the pack.
Centre. Yep.
Centre, thank you, of course. Late at night. Yeah, they're really helpful on the phone. And anything to do with the vaccine, if you had a cold chain breach or anything like that, they're the people to go to. That's who I would ring tomorrow.
Fantastic, thanks for that.
Helen, can I just come back to that question about the patient that didn't have a Medicare card? What we advise general practice in that case is to send those patients without a Medicare card to one of the COVID vaccination clinics, because they're well set up to provide that service to their patients that do not have a Medicare card.
I think you can do it. So even if they don't have a Medicare card, they're eligible for vaccination. And it is on page 10 of the onboarding document, part 1 of 3, which does talk you through if your practice software enables you to do it. Otherwise, you can manually do it onto the air. But equally, it's important to check if, not creating new records every time. They may already have a record. So I think if people can do it, because what we don't want is people being sent somewhere else and then they don't go. So I think it's really important. Perhaps if people can give that feedback and give it a go as a start anyway. Yeah.
That's always a challenge, isn't it? If someone turns up in the pharmacy and they're prepared to be vaccinated, so long as you take them through the consent process and you've documented consent, then I'd be very inclined to vaccinate before they escape, just in case they change their mind. The other thing that I just wanted to mention also, because we're now doing children from the age of 12 with Moderna and also from the age of 10 with influenza, Queensland Hospital and Health Service have put out some really nice info sheets on tips for immunising children of the age of 12 plus. and we'll share that too with you after this webinar, just because they're quite nice and concise and helpful. Okay, Robin, I'm going to end with a curly question for you. It's a loaded question. It's something that Naomi and the Guild and the Pharmaceutical Society and PRASA have been discussing over many months is, what do we do if the pharmacy becomes the hotspot? So I'd just like to give us sort of top 2 or 3 tips.
The most important thing is to always follow SA Health, and that's what we have found. Our group was one of the first pharmacies in South Australia to have a COVID case, one of our workers. And March 20, was it March or April? Can't remember, too long ago, 2020. And follow SA Health are really helpful and will guide you through it and tell you what you need to do, what you need to clean, etc. And they will be talking to the people and following the person who has COVID positive and tracing all their contacts and then informing them. So the best thing is to do, just not decide what you want to do, is follow exactly the instructions from SA Health, and that way you'll be following the guidelines as we say they change on a regular basis, but you will be doing what the emergency provisions are saying that we have to do. So the point number 1 is always just follow the guidance from SA Health, and they will help you along with your business of what you have to do. Into, do you need to clean or not? Is it just a surface clean? Is it a full deep clean that you do? They will know what tier it is and what you will need to do. So that's the biggest thing I can say is really follow SA Health's direction.
Okay, we don't have any further questions. I am going to share my screen again. There we go. So I would just like to thank everyone for their time tonight, particularly our speakers. Really appreciate you coming this evening and being able to answer questions of our pharmacists who are in for a very busy time, I'm sure, with a lot of interest from the community about the Moderna vaccine. So thank you very, very much. Thank you to Naomi, to Robin, to Bastian, to David, and to Amanda. There is a QR code that you can see on the screen. If you have got a QR reader or can take a picture of that, then we would really appreciate your feedback. There is a list of upcoming events here available through the PSA. If you're interested or you know of people that are interested in immunisation training, you can log into a wait list for South Australian events, and we are about to schedule another round because we've got quite a few people who are interested. There is a PSA Careers Connect session tomorrow night, so if you'd like another webinar tomorrow night, you can still register for that. It's led by Deanna Mill, who is a PSA SANT branch committee member, but also now ECP director. And also, I would strongly encourage you to consider coming to the SANT annual therapeutic update. Yes, face-to-face education and networking is back and happening 31st of October 2021 at the Sanctuary at the Adelaide Zoo. It's a full day. It's a fantastic seminar session, and we're starting off with a breakfast session, and then we have education sessions throughout the day and networking at the end of the day. So you can come and reconnect with your family. And there are also quite a lot of CPD credits on on offer for the practice audit tool for methotrexate and betamides. And I'm sure you haven't got time to finish that before the end of this CPD year, but you might want to plan this for next CPD year. It is grouped through 3 credits, so consider having a look at that one. And also just a reminder that PSA does have member insurance. So if you're considering your insurance options, have a look at that one. So in closing, thank you so much. Thanks for coming. Really useful session tonight. I hope you've got something out of it. We will be running some sort of small group workshops in the next few weeks to sort of work through some of the problems that people are having. So have a look out for those. They'll come out on the PSA website as well. Thanks for joining us. Thanks to all of our panelists. Stay safe and thank you. Bye.
Thanks, Robin.
Bye.
Helen.